The Alma-Ata Declaration is a landmark in the history of health sector. Health is the state of complete physical, mental and social well-being, and not merely the absence of diseases or infirmity, and is a fundamental human right. This historic event followed declaration of the Ottawa Conference.
The key points of the Ottawa Charter are to build healthy public policy, to create good environments for people's health, and to move towards a new understanding of health and people's health behaviors.
So, for me, the real significance is that slowly but consistently we have been trying to build up a body of conviction that it is not bluff when we are speaking about a new era in health, or new era in public health, or whatever you prefer. And that health promotion just conceivably might become the important lever for making a radical change in the way everybody is looking at health as you move towards the end of the century.
The Bangkok Charter gave call to all stakeholders for working together in a worldwide health promotion partnership. The outcome of these events was strengthened by the Rio Declaration on Social Determinants of Health to work for equity, so the inclusion of health in the policies of all sectors can be achieved. In the backdrop of these important events, we have geared up to address existing and emerging health challenges. Realizing that the inclusive economic development is the key to improve health status, Brazil has taken proactive national program for poverty alleviation, resulting in significant reduction of the people living below poverty line.
The Bolsa is good for us, but also for lots of other people. It helps us have more purchasing power.
What's important is education. They should give those of us who haven't had any education the possibility to study.
In India, a massive financial outlay has been allocated to further programs for improving the socio-economic status of disadvantaged people. This has lifted millions of people from their depressing situation. Addressing the factors of social discrimination has resulted in numerous innovative efforts. Appropriate political action and sustained efforts are addressing women's empowerment, but our failure to meet Millennium Development Goal agenda on reproductive child health needs energetic attention. It is clear that political commitment is the key to improved health status.
A commitment to universal coverage means, in practical terms, ladies and gentlemen, that all people within a country should receive some degree of financial protection from the cost of at least some basic health services.
Perhaps there can be no better example of this than in the Nordic countries.
In Finland, it's good to be a mother because you can trust that your health will be taken care of from the very start of pregnancy. I wasn't at all afraid of giving birth. Another thing is that during the first 9 months, you get maternity aid.
More than 8 million tobacco-related deaths have been predicted by 2030. 80% of them are in developing countries. Proactive legislative action by many governments, including the Government of Australia, has resulted in a significant impact on tobacco use.
From 1 July 2012, cigarettes will have to be sold in plain packaging, the most hardline packaging regime anywhere in the world.
We know that it will have effect on their marketing and we know it will have an effect on consumption, and is absolutely the reason that we are taking this action.
Many civil society organizations like the Voluntary Health Association of India and many others, along with the national and state governments, have worked effectively to increase tax on tobacco products, on bringing out smoke-free public places, on regulating smoking in films, and most of all, banning gutka, which is a form of smokeless tobacco. The industry interference has been countered through public interest litigations and also with strong support from the media.
To address the specific traditional and cultural needs, the beautiful Himalayan kingdom of Bhutan has evolved a futuristic concept of Gross National Happiness Index.
The government creates the conditions for overall happiness of the people. The level of mental health, psychological well-being, the level of education that they enjoy, the living standards that they enjoy, the level of cultural activities that they participate in, the level of social activities that they participate in, whether they are happy with the natural environment that they live in, to see whether the people are truly enjoying overall well-being and happiness.
The huge challenge remains: continuing burden of the communicable diseases like TB, malaria, diarrhea, and HIV/AIDS. By 2030, non-communicable conditions are expected to cause more than 3/4 of all deaths, and 1/3 of these will result from cancer, heart diseases, and traffic accidents. There is a tale of two cities. While one half lives in luxury, the other half can barely manage to reach the subsistence level. Global warming, environmental degradation are massive impediments to a healthy world. Fair employment and decent work remains a distant dream for many millions. Besides typical situations of developing countries, young, educated, unemployed in many developed countries are also facing depressing future due to the recent economic crisis.
Ja, het stomme is ook, je bent altijd afhankelijk. Nu ben ik afhankelijk van mijn ouders, omdat ik geen geld heb. En dat is wel niet zo fijn.
Social protection throughout life tenure remains a distant dream.
ให้มันตะวันตกเลยเข้านอนแล้วอยากให้มันพรุ่งนี้เช้าเลยมันชีวิตว้าเหวบางทีจะร้องไห้มาไม่รู้จะคุยกับใครเหงาโอ้ทรมานไม่มีเพื่อนฝูงทรมาน
Most of the developing countries invest far less than required to meet health goals. Health is a vital human good. Totally commercializing it for the sake of choice and efficiency runs a potent risk of compromising the integrity of medicine.
This doctor said you can't offer the same services with less money. The private companies invest to earn money and the health system loses out. The health system should always be efficient and of high quality.
Creative energy of the governments, non-governmental players, and public at large are gradually turning the tide. Clearly, it has been possible not only due to efforts of stakeholders of health sector, but numerous other motivated institutions of social and development sector. The challenges for the health sector are complex, but we also live in a time when the world is more knowledgeable and scientifically equipped. We need to ensure proactive engagement of all the players of development sector. We need to forge sustained partnership between government, non-government organizations and our citizens. In many ways, we are the choices that were made by the previous generations. The present and the future generations will be affected by the decisions that we make today.